Good evening to you all. This is Veer Maheshwar Charitable Trust Latur organizing daily international webinar series. And in this series, we are inviting the speakers from India and abroad. Today we have invited Professor Dr. S. Jayachandran sir, who is Honorary Professor of T.N.Dr. MGR Medical University, Chennai, and he will speak on the understanding the link between oral and general health. I welcome you, sir, and all the participants, those who are joined here, also including Dr. Sanan Shuklaji and all the participants. I am in journey, so I welcome you all, and I request our today's speaker to start the speech. Thank you.
Thanks to Dr. BETKAR for giving me this chance to participate in the webinar, international webinar series. And I'd like to give the talk on health awareness talk, particularly the understanding the link between the oral and general health. I'll share my screen, sir, now. Sir, my screen is visible, sir. Hello?
Yes, sir, visible. Please continue.
My slides are seen, sir.
Yes, please continue. Continue, please. Your slides are visible.
Okay, sir. Now it's visible, sir, completely. Hello? Sir, is it seen, sir? Hello?
Yes, sir. Yes, sir. Please continue.
Okay, sir. So this is
Okay.
Hello? Today's topic is understanding the link between the oral and the general health. So oral cavity is important, oral health is important for your general health is also concern. So I would like to give the brief note on what are the anatomy basics to structure. Oral cavity comprised of the dental structures as well as in the oral cavity, mucosa and the tongue and the palate and the gingiva. All the anatomical part is there, which will affect by the various diseases also. First, we must understand the basics to structure. The molar is a tooth. Its outer enamel is a very hardest.
Sir, please share your PPT. Now again.
Screen, sir.
Not.
Hello, PPT is not seen.
Not, sir. Please share perfectly.
It's not coming, sir. Something's smashed up, sir. No screen, sir. Hello.
Not parallelly, you can explain the topic and try it, because don't mute yourself and don't stop your speaking. You try parallelly sharing the screen and try to explain the subject.
Yeah.
Introduce your subject.
Structures are very important for your maintaining your health, as well as for the chewing of food and phonation, and for your chewing food and swallowing the food, and which also give the pleasant appearance for the face. So apart from this, these structures is also viable structures is also affected by the various diseases. Particularly it's caused by the bacteria which is present, millions of bacteria present in the oral cavity, which is contributing for the dental caries. Most common diseases or dental caries. Oh, 1 second, sir. I have minimized and kept it, sir. That's why it's not. Now it is visible, sir. My screen.
Yes, visible, but go to the PPT. Screen is visible, but PPT is not visible. You go to the PPT slide.
Yeah, PPT I minimized and kept it in the. Oh, it's PPT I'm not able to share, sir.
Yes, I have shared it. Please continue.
Okay, sir. I can change, change slides, sir. So oral cavity is important for your health, which is affected by the various diseases. The structure of the tooth, which comprises the enamel and the dentin and the roots portions, which is affected by various diseases, and also the supporting structure is called the gingiva and the periodontitis, periodontium, which is also affected by the diseases. When the gingivitis is progressed, the supporting structure of the bone is also affected. So in the early stage, minimal destruction will be happen, and you have to approach the dental surgeon for the oral health care maintenance. Next slide, sir. Next slide, please. Sir, next. Next slide, sir. Hello. Next slide, please.
I think sir is traveling. You go with your presentation if it is not visible, but you can continue with your presentation. Thank you.
Yeah. The common dental problems are the dental caries, gingivitis, and the impacted and the wisdom tooth, and the grossly decayed tooth, otherwise called broken or infected tooth, and also the halitosis, the bad breath, and irregular teeth, and the malocclusion. And another causes dental problems are the fibrosis of the mucosa, which is caused by the tobacco or the related product, and which may lead to oral cancer also. Finally, the missing tooth, which needs a replacement of the proper functioning of the teeth. And how the caries tooth is developing? What is the basic principle? So it requires the bacteria, teeth, and food. Bacteria is particularly lactobacillus and streptococcus mutans they are acid-producing bacteria which is present in the oral cavity in the presence of the unsaturated and carbohydrate on the tooth surfaces, which may produce in the presence of the carbohydrate or on the teeth surface, which produce the acid, which will destroy the enamel tooth surfaces. Ultimately, it leads to black dot formation and the caries formation, which leads to other structure involvement is a dentin and the pulp. The tooth will be very painful, and the patient leads to abscess and other consequences due to the caries. And next is these are some of the caries tooth which is commonly affect the children as well as in the geriatric population. In the children, it will be affecting the entire surfaces of the teeth because of the excess consumption of the sugary foods and the carbohydrates, which may lead to the caries tooth. And also in the geriatric population and the adolescents is also the caries is progressed. And if now the latest modern treatment is available, endodontic treatment as well as in the crown preparation, the function of the tooth can be maintained. So these are some of the pictures I am showing this before and after the treatment of the dental caries. And next is what are the likelihood of the tooth decay? The risk factors shared by the adult and the children include the bacteria. I told you the high count of the bacterial count, and diet is frequently consuming sugary food and drinks, inadequate fluoride supplements, and low saliva, which is also one of the salivary secretion is reduced, which leads to dry mouth, which is a cause for the many of the diseases in the oral cavity, including the dental caries and the fungal infections and the difficulty in swallowing. Other problems can also occur. The dry mouth is also occurs due to the many of the prescriptions. Elderly patients or geriatric population, they required multiple prescription. This drug-induced dryness is very common in this group of patients. So the aging, disease, and the disease treatment can contribute to risk for the tooth decay in adults. Next, coming to the gingivitis or gum problem, gum diseases is called gingivitis and periodontal disease. In the early stage, you can call it as the infection on the or inflammation of the confined to the gingiva is called gingivitis. When it is untreated cases, it may progress to the underlying supporting structures will be affected, particularly the bone, which may progress to the periodontitis or severe periodontitis. The tooth may start mobile and ultimately this tooth may fall also. Now the latest treatment is available. We can go for the flap surgery and this progression can be controlled and disease can be prevented. What are the risk factors for the gum diseases? Mainly smoking. Smoking is a very highly significant risk factor for the gum diseases as well as for the oral cancer. The smoking in the form of smoking as well as in the chewing of the tobacco in the any form is a highly risk for oral health as well as for the oral cancer development is also. It can affect the other system also, and also the hormonal changes in the girls and the women is also very common, particularly in the puberty and during the pregnancies. The hormonal changes which may alter the vascularity and the changes in the oral microbial flora, which may lead to gingivitis and other oral complications. Diabetes increase the risk of many infections, including gum diseases. And other illnesses, including the AIDS and other treatment, the cancer treatment, is also a risk for the gum diseases or particularly gingival diseases. Gingivitis is the inflammation of the, it is a simple term. So gingivitis is the inflammation of the gum. It's a very common finding seen in our Indian population, which is a redness of the gingiva, which easily provoke for the bleeding. Simple brushing also can induce the bleeding. It is called the gingivitis. Untreated cases in the non-destructive is called the periodontal. The underlying structures is the supporting structure is affected. It is called periodontal diseases. Most common form of gingivitis, in the most common form of periodontal disease, overall is responsible to the bacterial biofilm formation, which is responsible for the both dental caries as well as gingivitis and periodontitis. Biofilm formation is called a plaque. That is accumulation of the bacterial colonization of the tooth surface as well as in the gingival cervicular region, which may enhance the cause for the other diseases. In the absence of the treatment, gingivitis may progress to periodontitis. And finally, these are some of the clinical pictures I am showing. This is gingivitis, a marked gingivitis. There is a bulbous gingiva, there is a purulent discharge will be there, and the bleeding also will be there. Severe halitosis, tooth may start also mobile, which is also easily controlled or treated by the dental professions. The advanced stage of periodontitis, where the teeth will be completely lost the supporting structure, which is start mobile and automatically it may fall also. Now the latest treatment is available. Even the mobile teeth also can be saved with the help of the recent treatment modalities in the dental field. So the oral health is a general health is a A lot of scientific research has established link between the mouth infection and the serious medical problems, such as it is also linked with the diabetes mellitus, heart diseases, lupus erythematosus, and oral cancer is a different entity, and rheumatoid arthritis and the stroke, neurological brain stroke. These are the associations. There's a possible cause. Mostly it is related to the inflammatory product or cytokine released by the bacteria in the oral cavity, which is aggravating this or increases the progression of the diseases in diabetes mellitus, heart diseases. And there is you need strong health promotion message for these three oral diseases. One is caries and periodontal disease and oral cancer. These are I told you, these need the public awareness and the motivations, even the professional awareness is must for this caries. This are early diagnosis, early intervention definitely save the patient life as well as treat the conditions. Halitosis, I told you, there is a bad breath, otherwise called bad breath. The symptoms are noticeably odor. It's a pleasant on the exhaled breath. It is various causes is a third most frequent cause for the dental patient treating or patient visiting to the dental clinic is the halitosis, apart from the dental caries and the periodontal disease. The halitosis is one of the most worst conditions is caused by the various causes is there. Mainly it's a decreased salivary flow. Particularly in the during the night times, it may decompose with the other food particles and food materials, which may produce the bacteria colonization and the putrefaction, which may lead to breath, and also the gingivitis and the smoking and periodontitis and the smoking, alcohol, and the denture hygiene is some patients are using the denture artificial teeth set, which is also should be maintained properly. Otherwise, it may lead to severe halitosis. And the chronic lung disease and the sinus infection is another most common cause for the halitosis. So the oral halitosis is not confined only to the oral cavity. It may also lead to other connected to the other structures like lung and the sinus infections. Mouth infections such as oral candidiasis, because of the poor oral health as well as maintenance is very poor. Oral health is may not maintained properly, and other immunosuppressive conditions, and even the drugs is also can causing the candidiasis, which is also cause for the halitosis. Systemic diseases, I told you, diabetes mellitus, severe and uncontrolled diabetes mellitus, the glycemic level is very high. They have a purulent infections or inflammation in the gingiva, which may produce a severe halitosis, and liver diseases and kidney disorders also responsible for the halitosis, and pregnancies due to hormonal changes and improper oral hygiene measures is also another cause for the halitosis. Irregular teeth, otherwise called orthodontics. Now there's a lot of scope and the development in the field. The patient is also coming for the treatment of the irregular teeth. They want the neat and the placement of the teeth, which enhance for the proper functioning of the mouth, as well as for the chewing the food, and which deliver the good speech, phonation, and the swallowing, and also the aesthetic purpose they need for the correction of the irregular teeth. It is called orthodontics or dentofacial orthopedics. And orthodontic treatment helps to improve the oral health condition and the facial bone development too. And coming to this, so these are some of the treatment for the orthodontic. Now there are a lot of braces and other invisible orthodontic appliances which correct the teeth alignment, which is also available in the modern dentistry field. What are the preventive measures? So the need routine self-care, brushing and flossing of the teeth. That means the routine self-care, the home care measures is very important for a proper oral health care. One is twice brushing, morning and night brushing is a must, and brushing and flossing. Flossing is will be taught by the dental professions, which will clean the interdental region, and also appropriate fluoride toothpaste, and dietary choice, limit to sugar intake, and also diet is also should be consumed, and other rich antioxidant food should be taken to maintain the good oral health, and stop tobacco use And I told you, any form of tobacco use, either in the chewing form or the tobacco smoking form or in the tobacco related product, which is a very highly risk for the developing other oral cancer, and also is deteriorating the oral health, and limit alcohol and elevate dry mouth symptoms. I told you this dryness is a mouth is full of saliva, is one of the major protective agent in the mouth, which defends for the bacteria and other viral infection and colonization of the fungal infection. So dryness, if reduces saliva, definitely leads to the complication. So the dryness is there, definitely you consult the medical profession or dental profession to treat this condition. And routine preventive visits. So yearly 2 visits to the dental profession for any problem in the dental care, dental or in the mucosa or in the oral cavity, which catches the problem in the early stage. Even in the oral cancer early stage, if you diagnose, definitely it can be treated and improve the quality of the life of the patients. So these are some of the preventive. And the oral health and diabetes. Diabetes is one of the hormonal condition where the insulin is deficient. There is a which may lead to a lot of infectious conditions, and it can affect all other systems of the body, including the oral cavity. Diabetes mellitus, which leads to patient will have a prone for the gingivitis and the periodontitis and multiple periodontal abscess. They will come for the dryness of the mouth and including the candidiasis. So they need treatment for the both oral cavity, oral health care measures, as well as for the treatment for the diabetes. Sometimes there will be interrelated, increasing the or progression of the diabetes or uncontrolled glycemic control. Sometimes if we treat the oral condition, improve the oral health, including the treatment of the periodontitis, gingivitis, it definitely reduce the diabetes progression. It can also respond for your treatment. And the oral health and the heart disease. Heart disease is also related to the dental care. That's why the patients come for any dental treatment. They will ask for have you undergone any major heart surgery, or have you taken any preventive drugs for the controlling the bleeding or aspirin and all, because which may lead to subacute bacterial endocarditis when you without the proper history. That's why it is related to, because they are prone for the development of the colonization or clogged formation in the arteries, which may aggravate the subacute bacterial endocarditis. So this patient is required some special dental care in this. So this is also, heart is also related to the oral cavity. And next is osteoporosis. So mostly the patient with the menopausal stage and even in the older age, they have osteoporosis with a lot of calcium is withdrawn from the bone. The bones will also weaken. They also come for the dental treatment where the periodontal bone loss will be there. They have a mobile and the shaky tooth will be there. They are prone for the easy loss of tooth structures. So then they need the special treatment care, including the implant procedure and the replacement of the lost tooth. Oral health and the pregnancy. During the pregnancy, the oral health care is very, very important, because they have altered hormonal changes. They are prone for the oral infections. Oral infection, the dryness of the mouth, and the gingivitis and the periodontitis is very common in this during the pregnancies. Hence, they need a proper oral health care measures during pregnancy in the first trimester and second trimester and third, all the trimesters. They have to follow the proper oral health care, which I have advised earlier. Twice brushing also they need, and also the dietary measures they have to follow. Every time after food also they have to gargle it, and nighttime brushing is also must. Even they have to clean the tongue also, because the tongue coating is very common in the pregnancies. And these patients required some special attention during the pregnancy period. Oral health care. And the oral health and the respiratory disease is also very easily coordinated with these conditions, because the possible mechanism which oral bacteria promote colonization of the oral cavity and the lung. So these multiple organisms is there. These organisms get colonization in the lung also, which may aggravate the bronchitis and bronchiectasis, other lung-related complications because of the inflammatory substance which is present in the oral cavity. Well, coming to the message, the brushing is very, very important. I told you the improved oral health care measures means mainly the brushing. The regular brushing and the flossing are the foundation of the good oral health. 2 to 3 minutes twice a day and the floss to get rid of food debris and the plaque. Just 2 to 3 minutes. Don't do the more than 5 minutes or 6 minutes. It will abrade your teeth also sometime. So limit your brushing morning and night. Frequent brushing is very important. And use of soft toothbrush and focus on the area where the tooth meet the gum line, because there the very potential, the gum and the tooth line meeting is a very potential line for the bacterial colonization. I told you it's a biofilm formation which required to be cleaned very smoothly and it should be eliminated from the oral cavity. So use a fluoride toothpaste, appropriate fluoride toothpaste, particularly for children also, they have to use the appropriate fluoride toothpaste as per the direction of the dental professions. And supervise the children until about 8 years old, because they are prone for the multiple caries because they consume a lot of sugary items and carbohydrates is very rich, so which may lead to caries. So they need some special supervision for up to 8 years old. And oral hygiene instructions, regular visit to the dentist, I told you, yearly 2 visits, preventive issues or the treatment visit also must. And replace the toothbrushes. Toothbrushes should be replaced once in 2 to 3 months, because once it's worn out, it will not be very effective cleaning your teeth and it should be discarded. These are the very basic measures to improve oral hygiene. What are the right way to brushing? How to brush your teeth? And this is very important steps. Brush at least 2 to 3 minutes. I told you already. The properly brush your teeth. Use a short, gentle stroke, paying extra attention to the gum line or to reach and back teeth and areas around the fillings and crowns, because now the patient had a lot of fillings and the crown and bridge and artificial teeth that they need some concentration on the thoroughly cleaning area as section B. Clean the outer surface with your upper teeth, then your lower teeth, and clean the inner surface with your upper teeth and then lower teeth. Clean the chewing surfaces. All the surface of the teeth should be brushed and clean. And for the fresh breath, be sure you brush your tongue too also. Tongue should be very gently brushed. Don't use the blade and all. It will remove your all the papillas or taste buds. You will lose the taste sensation. So use the gentle brushing and remove all the debris accumulated on the tongue surfaces. What are the brushing techniques? Steps 1 is a brush at 45-degree angulation is important, and from the gum line, and sweep or roll the brush away from the gum line. Just up and down movements around. You have to keep the 45-degree angulation and remove all the debris. Gently you have to do it for all the upper jaw and the lower jaw. And then coming to the step 2, the gentle brush on the outside and inner side of the chewing surface of the teeth. Outside and inner side of the chewing surface, the 2 surfaces, and the back and forth stroke in the chewing surfaces. You have to do the back and forth, and because the outer surface, chewing surface, a lot of grooves and pits and fissures are there, so there tends to accumulate a lot of food particles. So need very clean attention for removing all the debris accumulated in this potential region. Step 3, gently brush your tongue to remove bacteria and freshen the teeth. This also I have told you. Apart from this, the oral cavity is also vulnerable for the using the tobacco. I told you, tobacco is a very, very risk factor for the most of the oral cancers, and it may also lung cancer. It is a very risk factor for the whole system of the body. So the oral cancer in the early stage, using the tobacco in the smoking form or the chewing form, they're prone to develop some changes in the oral cavity, because chronic smokers and the chewers, they develop particularly some white lesion or white patch, which is not painful. That's why they neglect, they will not come for the dental profession or a treatment. That's why I'm telling you, the self-examination of the mouth is very, very important when you're doing the, like your breast examination. So we are also insisting for the self-examination of the oral cavity, which will definitely prevent the most of the disease occurring in the oral cavity. So any alteration, any changes, or either it is a painful or painless, just to examine. And if you notice any alteration, better you visit the professionals and check for the whether it is a pathological condition or it's a normal variance or it is a other conditions the cost is. So that better you go for the diagnosis and do the necessary treatment. So the tobacco, I told you, because initially it may produce white patches, which is painless, particularly if it occurs in the underline of the tongue, tongue region, which is the base of the trunk. It is a very, very, very risk the developing the cancer. And the tongue is also supported by the other next picture I'm showing. There's a white patches, which is the risk for developing, because it is called leukoplakia, white patch which is occurring on the leukoplakia. It is potential for the turning into malignancies. It's called pre-malignant conditions, otherwise called precancerous condition or potentially malignant disorders. Now they're calling it as. So these are the conditions. And if it is untreated cases and continuously using the tobacco, other risk factors which may lead to ulceration or fungation of the growth, which is a frank malignancies, which required other biopsy and other treatment modalities which is available in the tertiary care center, particularly in the cancer treatment centers. And these are some of the cancer pictures I'm showing. These are the tongue cancers, which is very, very unfortunate to develop these conditions, because in the early stage, early intervention, early diagnosis, and mouth self-examination and the stoppage of the tobacco usage, which was one of the preventive measures, definitely it leads to improve the quality of the life of the patients. And also now this, even in the oral cancer patient, there are available, treatment is available in the most of the tertiary care centers, in the cancer treatment centers is available. So the dietary habits, avoid frequent snacking. I told you, mainly the sugar food to improve the oral hygiene. Avoid sipping of sugary beverage in all days, and drinking water throughout the day, which maintain the wetness of the mouth and neutralize the acid that causes decades. And to choose healthy snacks for self and as well as the children's. And sticky food, you can avoid the sticky food during the meal hours. And follow the oral health care measures, and you can avoid most of the diseases. And also the visit the dental profession once in every 6 months for any preventive measures or the early catch-up of the diagnosis of the diseases, including the oral cancer. So these are some of the message I want to convey to this population, convey this message to the participants. I thank you for your patient listening. I don't know whether my slides are worked or not, but anyway, I convey the message orally. Thank you very much, sir. Hello? Hello? Yes, sir. Hello? Hello?
Hello.
Yes, sir. Sir.
Yes, Sirji. Very, very nicely presented the topic, and it is one of the very vital and day-to-day topic. And one should be very, very careful about the oral hygiene. The reason, I think you have said so many diseases are connected with the oral hygiene.
Yeah.
Many of the time it happens that, I've seen some cases where the dentures are not ill-fitting dentures, or maybe your teeth, is little, what we can say, it's sharp or something like that. In some cases of a cancer malignancy developing out of this. So I think one has to be very careful. Don't be ignorant about that. And I think you have said very correctly about those points. One very important question is, if oral hygiene, when we are talking about, and the salivation, you have said a wonderful thing.
Yeah.
If suppose less salivation is there any kind of gastric disturbances or GORD or GRD? Nowadays, these are the very commonly used terminologies,
Yes.
gastroesophageal reflux conditions.
Reflux conditions.
So, whether it is associated with that, what you think about this, Dr. Sir?
Yes, sir. GRD and gastric reflux diseases will be very much associated with the salivary decreased salivary secretion, sir, which is indirectly it is affect the salivary gland function, sir. Even the minor salivary gland, the major salivary gland functions will be altered. Because of this alteration of this salivary gland function, its secretion will be reduced, which may lead to dryness or hyposalivation. They reduce the salivary secretion, or it may completely total loss. It's called xerostomia. Even the varieties of drugs is also causing this. Even the antihistamines, other cancer drugs, and a lot of other, because particularly this xerostomic condition is very common in geriatric population, particularly in the elderly populations, because they have taken the polypharmacy, because they are a lot of consuming a lot of drugs, which is encountered for this xerostomia, even in this GRD condition also, sir.
Thank you, sir, for your inputs in the aspect. And one more thing is there that the fibrosis, mucosal fibrosis is very common. And in our country, I've seen people are having so many chewing habits of tobacco and smoke tobacco, what they call mystery, and various products are present. And that is also very important aspect. One has to be careful that tobacco prohibition is one of the very important aspects you have already mentioned about leukoplakia.
Yeah.
And one more thing is there, about the oral cavity when we are saying, especially the geriatric groups, the older people, elderly people, where you find there are a lot of teeth are there and they are not selecting the dentures or something like that. And it affects their health very badly because they cannot chew the food. And I think that first step where it is got lost, that food is not processed. And naturally the further process sequelae get also disturbed. So I think that is one of the very important aspects. And one aspect what I feel, weaning phase, the when means that especially when the child is getting teething, the general health very, very markedly affected. The child doesn't want to leave milk and the breast milk and other things, and they doesn't want to go for other food stuff. So that also, I think, that dentition time. So can you focus some light on this aspect, on dentitional aspect? So, I'm a practicing physician and we can use this knowledge in our day-to-day practice. Thank you, sir.
For children, sir, they are very prone for, because these are milk teeth, because 20 teeth will be there in the period. Because these children's oral health care is very important, because the parents or the mother should take care of the health. Every time they have to brush the teeth, or even the eruption of the teeth, they have to take care, because they're drinking milk, as well as the sugar consumption is also very high. They develop the caries also, because they have to, during the night time, they'll give the milk also with the sugar substances in the feeding bottle. These children are very, very high risk for developing the dental caries in the anterior teeth, particularly in the front teeth and the maxillary teeth. This is called bottle baby syndrome, or feeding bottle syndrome, or aggressive caries, or rampant caries. There is various terminology has been used. And because this affects the normal function of the children's food, also consumption of the food, even the speak, even the psychological, they affect also, because they lost anterior teeth. So these they should take, the parents should take care. And in the early dental caries, suppose they notice, they have to visit the dental profession for the intervention, as well as they have to take the advice from the patient, advice from the doctor. And the brushing is also must. I told you, the junior brush and the soft bristles, and morning and night they have to brush, and the habit should be created. And also every time they have to gargle every time after food, because after taking the sugary food, they have to gargle it. And brushing is also must, sir. And now there are a lot of dentistry, pediatric dentistry. There's a lot of restorative materials is available. The tooth colored is also. They can also replace whatever the tooth structure is lost. they can replace easily, because anyway their teeth will be exfoliated, fall, and they'll get the new teeth, the adult teeth, that the primary teeth they lost, then they'll get the secondary teeth and permanent teeth, which will be present for your lifetime. So they need from pediatric to geriatric, the oral health care very important. Maintenance of the dental health is very important, sir.
So the last point what I want to discuss is, some people are taking too much of care of teeth. Now and then they are brushing and they are working very hard, and that obsessive compulsive condition also disturb the oral hygiene and oral cavity, and especially the teeth structure.
Yeah. Because the over brushing is also lead to this abrasion of the teeth, sir. That's called abrasion. Sometimes the teeth structure, enamel structure. I told you in the anatomy structure, the enamel is a very hard substance. Even it is not easily removable. But if you're doing very aggressive brushing with using the abrasive toothbrushes and all, abrasive toothpaste and tooth powder, which may leads to the enamel loss. So once the enamel is lost, it cannot be grow, sir. It may definitely, it may lead to the patient will have a sensitivity of the teeth, because whenever they take hot or cold drinks, they will feel very sensitivity, because the overlying the enamel is lost, the underlying the dentin nerves are exposed. So which is cause for the sensitivity of the teeth. Now the latest treatment is available. They have a desensitizing toothpaste is also available, which we are advising from the professionally, sir. Hello.
Thank you very much.
Thank you, sir.
थैंक यू। देवीर सिंह जी, आप कुछ कहना चाहते हैं?
जी नमस्कार जयचंद्र सर। नमस्कार जी।
नमस्कार सर।
सर मेरा एक सवाल है कि आज जो फैशन की दुनिया है, इसमें जो दांतों को अच्छे होते हैं, वेरी नेचुरल जो भगवान ने दिए हैं, उनका जो शेप बदलते हैं और फिर कैप लगवा देते हैं, तो ये शरीर खतरनाक हो सकता है कि अगर दांतों में कोई रोग हो तो ठीक है, कैप लगाते हैं, चांदी भरवाते हैं, कैविटी होती है, लेकिन आजकल क्या हो रहा है कि जो भगवान ने कुदरत ने दिया है उनको भी छेड़छाड़ करके हम कैप लगवाते हैं, उनको डिजाइन बदला चेंज करते हैं। इसके बारे में आप क्या बताएंगे कि क्या नुकसान हो सकते हैं इसको?
Yes sir, yes sir. The toothpaste is very important. I told you, we have to brush morning and night, and if you have any cavity development in your teeth, better you visit, because this cavity will not be stopped once is a program. Once it started, definitely the progress. You need to replace the that cavity by using some restorative materials, and the cavity should be filled. Then only you will get the good function. And the toothbrushes also should be replaced once in 3 months, because once is the worn out, definitely to damage your teeth. So better you use whatever the protocol I informed in the lecture. You have to better you follow it, sir. Thank you very much.
Anyone who want to ask the question? धन्यवाद जयवीर जी, आपने अच्छा क्वेश्चन पूछा है। चांदी या कुछ भी कैविटी में भरते हो क्या सही है क्या? तो धन्यवाद सर आपका। और कोई पूछना चाहते हैं तो पूछ सकते हैं। आज मैं जर्नी में रहने से प्रॉपर्ली आई कांट शेयर दी स्लाइड्स,
problem sir.
I will share the PPT in the group. They will read it.
Yeah, better sir. Even I will share my slides also to your mail aid, sir. You can share.
Yes. Thank you, Dr. Sanand Shukla ji. From so many days we are here, and this event becomes live because of you only. Thank you.
हेलो सर।
जी
हेलो।
सर
अगर कितने मिनट से ब्रश कर सकते हैं सर?
2 to 3 minutes, sir. Gentle brushing, morning and night. Twice brushing is must. 2 to 3 minutes. Use the soft bristles, and you have to cover all the entire tooth surfaces should be cleaned and brushed. 2 to 3 minutes, sir, not more than that.
Okay, sir. Thank you, sir.
Thank you, sir.
You can unmute, sir.
Okay, sir.
Good evening, sir. Thank you for the wonderful session, sir.
Yes, Jayachandran, thank you very much for joining this group. Thank you.
Thank you, sir. It's very useful for us. Okay, sir.
Can I exit, sir, now?
Yes, yes. To fill the feedback link. Participants are requested to fill the feedback link in the group. And Jayachandran sir, you have to share the feedback link to your friends to whom you have invited. Okay. Thank you, sir. Thank you, sir. We'll meet tomorrow again.
Thank you, Dr. Sir.
Thank you. Thank you tomorrow.